What is the legislative history of the Affordable Care Act? The journey of the Affordable Care Act is a fascinating tale of political negotiation, public advocacy, and significant legislative milestones. It all began in the early 2000 decade, when rising healthcare costs and millions of uninsured Americans sparked a national conversation about healthcare reform. The urgency for change became even more pronounced as the economic recession of 2008 highlighted the vulnerabilities in the existing system. In 2009, President Barack Obama made healthcare reform a top priority of his administration. The Democratic Party, holding a majority in both the House of Representatives and the Senate, began drafting legislation aimed at expanding access to healthcare and reducing costs. The process was complex and often contentious, with various proposals and amendments being debated extensively. The House of Representatives passed its version of the legislation, known as the Affordable Health Care for America Act, in November of 2009. This version aimed to create a public health insurance option and included provisions to expand Medicaid eligibility. However, the Senate had its own version, the Patient Protection and Affordable Care Act, which was introduced in the Senate Finance Committee. After much negotiation, the Senate passed its version in December of 2009. The legislation faced significant opposition, leading to a series of amendments and compromises. One of the most notable moments came when Senator Scott Brown won a special election in Massachusetts, which shifted the balance of power in the Senate and complicated the Democrats' efforts to pass the bill. Despite these challenges, the House and Senate ultimately reconciled their differences. In March of 2010, the final version of the Affordable Care Act was passed by the House and signed into law by President Obama. This landmark legislation aimed to provide health insurance coverage to millions of Americans, implement consumer protections, and reduce healthcare costs. The Affordable Care Act has since undergone various changes and faced numerous legal challenges, but its core provisions have significantly impacted the American healthcare landscape. The legislative history of the Affordable Care Act illustrates the complexities of policymaking and the ongoing debate over healthcare in the United States.